Hi, my name is Natalie Goodell, and I'm going to be talking a little bit about my research paper and the topic that I chose to write it on. So, first things first, I decided to write my research paper on the healthcare professional shortage. I knew that I wanted to write something that would correlate with my major. I'm a nursing major. I'm currently in the nursing program at MV, and I absolutely love it. I also wanted to kind of figure out why this keeps kind of snowballing. We have seen that this has been a predominant issue, especially in the early 2000s, and it's just persistently gotten worse and worse. I would say, especially after the pandemic, we have seen that, it's becoming more of an issue, why people are leaving the field, why there's such a shortage. But unfortunately, I haven't really seen many people talk about a possible solution. So that kind of got my gears turning in my head, and that's why I decided to write my research paper on this. Also, I started my clinical rotations in October. So I have been in the healthcare setting. So I have seen firsthand at the hospital, honestly, the lack of people that are there, which is really unfortunate because I feel that these nurses, care techs, doctors are being spread very, very thin. They have a lot of patients and a lot of people that they have to see. And unfortunately, it is a very exhausting and intense job as is. And with the responsibility that keeps getting put on them due to the lack of people that are in the field currently, it's a lot. So I wanted to write about this topic to hopefully get some ideas as to how we can fix this issue. So the first piece that I wrote about in my research paper, was burnout. I focused a lot on burnout because I think that this is a really, really important issue that we are seeing is one of the leading causes as to why people are leaving the healthcare field. Nursing, physician's assistant, nurse practitioner, anything like that, it's a very intense job. It's a lot of school, it's a lot of hours, it's a lot of pressure to, take care of people, keep them alive, and do that with, 6 to 8 patients at a time. It's really, really difficult. And so, this is one of the leading causes as to why people are leaving, unfortunately. And especially with the healthcare shortage, more is being put on our healthcare professionals because there's not enough people to help out, which is really unfortunate because this is having people leave. It's a lot on them physically, it's a lot on them mentally, and they're exhausted. And honestly, there's really nothing else that can be done besides having more people in the healthcare field to help pick up the weight and really just make sure that each person has enough time to get their work done, but also have enough time to care for themselves. The next topic that I decided to elaborate on a little bit more was migration. I'm very glad that I actually found this in the research process because I did not know that this was such a significant issue until I actually read the articles and wrote about it. I feel that migration is right up there with burnout, which may not seem like such a big problem in such a well-developed nation like the United States, but after reading, a lot of the lower developed nations across the world are really struggling with migration and losing those healthcare professionals because these people want more opportunities where they can work in better environments, get paid more, and so they are going to these more developed nations to also maybe advance their career and education. And that leaves the lower developed nations with not as many people to work and probably just as many people that are sick and need care, which is really sad because unfortunately there just are not enough healthcare providers and professionals to help the supply and demand ratios that are in those lower developed nations. I also learned in my research process that countries do make agreements with each other to facilitate healthcare workers from country to country. And I didn't really know much about that until I did my research, but I found that it was really interesting because sometimes these people don't even have a say as to, oh yeah, I want to stay in this country. Maybe it's more of a bigger issue and, legally they have to go. So the migration is definitely a big issue. The next topic I decided to also write about, which I kind of briefly touched on, was specialty. I also thought that this was pretty interesting because these people aren't necessarily leaving the healthcare field, but they are advancing their education, which is by all means great. But it's leaving less general practicing doctors and physicians, and instead people are focusing more on a specialty. And it's not all that bad, but there are less general practicing doctors, like I said, which is really important that we have those, because those are our primary care providers, and those are the people that we need more of, because as we know, especially in this area, it's really hard to get into a new doctor. So having more general practicing healthcare professionals would allow for these physicians and doctors to see less patients, and also to relieve their exhaustion, because it is also a really, really intense job. So the last little bit of my research paper, I wanted to focus on some possible solutions. Obviously, this is a really, really big issue, and like I said earlier, it's kind of snowballing and getting worse. So what I talked about probably would not solve the whole thing. But with educational reform, I really do believe that we can at least put a little bit of a dent in fixing this issue, with making the right investments in education, and providing more students in this current generation the opportunity to get into nursing school and medical school, because we see with the lack of instructors, programs are becoming more selective. So with making the right investments and hopefully more instructors, we can provide more opportunities to people that want to either start their education or further their education, as well as providing education for those in lower developed nations. I think that would tie right into migration, because with establishing other programs in lower developed nations, there may be less chance that the people that are learning would want to leave the country and instead would want to work where they're getting their education. It's a pretty hefty issue. But I'm very grateful that I got to research this, because I think that it's going to be a very talked about issue going forward. And unfortunately, if we don't act soon, we don't know what's going to happen in the future. And we really need these healthcare professionals. They keep us alive. So it's really important that we value them and establish other programs to help get more people involved in the healthcare field. So with that being said, thank you so much for listening to why I wrote my research paper on healthcare professional shortage, and all of the possible solutions, hopefully, that can help solve it. Thank you.